So now I'm pleased to introduce Dr. Joel Moody. Dr. Moody is the current CPO. I was characterized as 3 CPO because I was the third one, from a Star Wars point of view. Anyway, Dr. Moody came from us as I was retiring from the Electrical Safety Authority. What is most impressive about Joel is Executive Education Certificate in Strategic Management of the Regulator and Enforcement Agencies program from Harvard University, a Doctor of Medicine and an Advanced Certificate in Epidemiology and Biostatistics from George Washington University, a Master's of Public Health, International Health Epidemiology from the University of Alabama in Birmingham, and a Bachelor's of Science in Engineering, Civil and Environmental Engineering from Duke University. And I asked Dr. Moody to come and introduce our first plenary session.
Good morning, everyone. We'll definitely say thank you, Ron, for letting people know I was a student for many, many years. Didn't want to grow up, which is fine. But do want to say good morning, and it's very hard to follow our minister, but Minister, we thank you very much for your leadership and what you're doing to help move the province forward, not only from a health and safety standpoint, but also from the ability of ensuring that we have workforces that are stable, ensuring that we're making workforces of our youth, and so thank you so much. To our organizers, this year's theme is around outputs and outcomes. Ron mentioned the concept of epidemiology, and what we truly are looking for is the so what. We do a lot of different things, but what is the actual outcome that we're doing? So we want to move from that knowing standpoint to doing, from publishing the findings to changing systems, from activities to really measuring the impact on our workers. Because research alone is not the only thing that will change our workplaces, but it's that adoption, accountability, alignment, the items that you put forth in your view this morning. So this symposium today is, we're going to talk about some of those gaps, and we have some great speakers, and we'll examine how our evidence is translated into those decisions by employers, insurers, regulators, labor, research, service providers. Because at the end of the day, how does accountability influence that implementation? So this is not just about theory. It's about application. So what actually changes? What are the rates? What are the outcomes, the inputs? And we also recognize that outcomes are broader than just the incidents and their statistics. They have real-world impact. So we want to challenge assumptions today. We want to ensure that we're always having that willingness to question, to open, to try to understand differently what is happening and confront our biases. So that requires our expertise and experience. So thank you very much for being part of this discussion today, and want to welcome to you the symposium. So our first presenter today is Dr. Arif Jetha. He's Associate Scientific Director at the Institute of Work and Health, Associate Professor also at the Dalla Lana School of Public Health. And I think you're going to be talking about AI, something that is new, something that's having some challenges. And so we look forward to hearing and drawing on your research today. Thank you very much.
Okay, good morning, everyone. I'm delighted to be speaking here today and delighted for the invitation. I'd like to start off by a question to the audience. Who here can explain the concept of AI? If you were to sit in a room and be able to explain it in maybe a minute, would you be able to do that? Maybe show of hands, who feels comfortable? Okay, so I see 2 hands up in the front, and those are also my colleagues. Who here uses AI? Put your hands up. Okay, so this is like a majority of the room. And I think this is the gap. We are using it, but we don't know what it is, and that's pretty much the purpose of today's presentation. We're going to be doing a little bit of talking about what AI is, what role it can play, And maybe what are some of the big implications for health and safety leaders in order to better regulate, to ensure that our workplaces are safe, because these tools are being rapidly adopted with or without workplace rules and policies. And so I think this is an important topic, one that we ought to be really thinking about. I just want to introduce the organization in which I'm based, and that is the Institute for Work and Health. There we go. We're a not-for-profit research organization that's been around for over 30 years. We're amongst one of the bigger occupational health and safety research centers globally. And we do research at the intersection of work and health, how the work environment affects the health of workers, and how having a health condition can impact one's ability to work. We operate with core funding from the Ministry of Labor, Immigration, Training, and Skills Development. We've worked quite closely with the WSIB for many years, and we've been the recipients of funding from the Work Safe Ontario Fund. So we feel pretty nested within the Ontario health and safety system, and we're delighted to have many of our colleagues in the room here today. I also want to just give a quick shout out to the work that we're doing at the Institute for Work and Health. We're leading large-scale, long-term research on the implications of AI on the kind of relationship between work and health. We're working very closely with provincial and federal policymakers, workers' compensation boards, folks who are kind of nested in the AI ecosystem in Canada. And we are building long-term research in this area. So a lot of the stuff that we'll be presenting on today is kind of based on this evidence. But we have more to come, a lot more kind of evidence in the pipeline, so feel free to kind of stay tuned, connected to our organization, because we have a lot going on, and I'm delighted that many of our health and safety partners are part of this work. Okay, so we're gonna do a bit of level setting, because I find that when we talk about AI, again, many people don't know what it is, so I'm gonna not get too technical, but let's provide some definitions here. So when we think about AI as a term, we're thinking about it as actually an umbrella term. It's actually a cluster of different types of technologies, but at a broad definition, it's the use of computing machines to solve problems traditionally requiring human intelligence. So if we think about this as an umbrella, the next level of the umbrella is machine learning, and this has been around for a while. It involves using algorithms on large and complex amounts of data to find patterns. And here, using these patterns, you can then make predictions, or the machine can then make predictions. If we go kind of further down this umbrella, we see the concept of deep learning. And here we're using neural networks, which are algorithms that are structured like our brains. And they can stimulate complex decision-making, just like our brains. Innovations in deep learning, including the use of large language models, and like ChatGPT or Claude, these are examples of large language models. They've been at the forefront of machines being able to match or surpass humans in performing certain types of tasks, including some involving image and speech recognition. Another thing to note is that when we think about AI, we have to think about kind of three fundamental components: the algorithm, the data, and the computing power. Algorithms are mathematical rules that help identify patterns in data. When we think about data in terms of AI, we're not just thinking about numbers, we're thinking about images, text, audio. These can all be utilized to train an AI system. The design of algorithms, the selection of data, determines how effective the AI can be and who it benefits and who it might disadvantage. And what we're seeing now is that rapid advancements in computing power, they've been at the heart of AI growth and have enhanced its ability to train really complex algorithms on very large and complex data sets. One thing to note, and I think this is quite challenging when we think about the concept of AI, is that it's often utilized in conjunction with other types of technologies, like automobiles, mobile devices, sensors, robots, Internet of Things devices. So sometimes when we're trying to kind of untangle what is the AI in this whole kind of a loop, it can be quite challenging, and then it creates even more challenges when we're thinking about creating health and safety policies that are kind of relevant to AI. So we're seeing a lot. We're seeing a lot of investment in this tool. And what we're seeing is that actually the tool is being used to augment job tasks or enhance the work being performed by human workers. It's not replacing us just yet. And so for some, AI may be optimized to perform the most strenuous job tasks, and that can free up time for us to focus on more strategic or creative work. AI can process vast amounts of data quickly and accurately, and that could lead to better decision making, fewer errors, and greater innovation. AI is expected to redistribute and reorganize work activities between humans and machines. And this is important when we think about it from a health and safety context, because it's really changing the physical and psychosocial working conditions to which we're exposed. And it's going to create new health and safety challenges, which we'll dive into over the course of this presentation. So I provided some definitions, but it's kind of hard to understand what this means in practice. So I'm going to provide a couple examples to bring this to life, because I think this kind of helps us understand. So in this picture, we're seeing a John Deere tractor. So John Deere is a big tractor company, and they're now using AI to coordinate farming systems. And they do this by connecting autonomous machines, sensors, and data platforms. And so you're seeing here is not a human-driven tractor, but an AI-powered tractor. And it uses computer vision, cameras, neural networks to navigate fields. It does this in conjunction with drones. And the drones can take pictures, analyze data, and kind of help the tractor navigate the farm. So now you're seeing farmers able to manage their entire crops more efficiently using their cell phones rather than having to sit in the tractor all day. This is a technology called AlphaFold, and it uses deep learning to understand a protein's 3D structure. In the past, it would take scientists 4 to 5 years to kind of unpack this protein structure, but now they're able to do this almost instantaneously. And why is this important for us? Well, it's going to accelerate drug discovery. It helps us understand diseases better. It's going to advance fields like biotechnology and synthetic biology. And what that's going to then have a trickle-down effect is we're going to be better able to treat really complex chronic health conditions that maybe we haven't been able to in the past. This is maybe an example that you might be more familiar with, and this is in fulfillment centers. AI-powered robots can now move shelves of products, sort items, optimize picking routes, and oftentimes they're working alongside humans to do these tasks. Currently, companies like Amazon employ close to 1 million robots, and this is a growing number, and this is all, again, leveraging AI technology. This company is called Midjourney. It uses generative AI to create images from texts and prompts. It's guided by patterns learned from past images, text, and data sets, and it produces coherent images and videos that match a user's description. So here, I typed in, let's see Michael Jordan dunk on LeBron James, and it produces an image that's pretty lifelike. Obviously, it's not real, it never happened, but it's just kind of fun to kind of play around with these tools sometimes. Okay. So we've provided a bit of a definitional understanding of AI, provided some examples. So I'm now going to have a little bit more engagement with the audience, and we're going to play a game called Fact or Fiction. I'm going to read out a bunch of statements, and I'd like to see with a show of hands if you think the statement is fact or fiction. So here's the first one. We'll start this out. Fact or fiction? All Canadian companies are turning to AI. Put up your hand if you think this is a fact. Okay, we're seeing a few hands. Okay, let's put up your hand if you think this is fiction. Okay, all right. So if you said it was fiction, you'd be correct. While investment in AI is high, employer AI adoption actually remains very limited. And this is a stat that I like to show, is that according to Statistics Canada, only 12% of Canadian companies report adopting AI to produce goods or deliver services. And this is despite a lot of companies actually deciding that they want to invest in AI strategy. So the investment dollars aren't matching with the adoption. So we're not seeing the rapid use of it in the field as much as maybe the media makes it out to be. Okay, next question, fact or fiction? Workplaces turning to AI, so those who actually decide to invest in it and use it, they're seeing measurable productivity benefits. Put up your hand if you think this is fact. Okay, put up your hand if you think this is fiction. Okay, so many folks in the room think this is fact. Well, if you thought this was fact, I can tell you it's fiction. Few companies are reporting significant gains from their AI investments right now. And so this was a survey of business leaders conducted by the consulting firm KPMG. And what they found was that only about 2% of Canadian companies are seeing a return on investments related to AI. And in my view, this might be just related to where we are in the genesis of the technology. People are still exploring it, trying to understand what works, what doesn't, what can benefit their company and what might not. And so maybe over time, this return on investment might change. But right now, despite people being interested in it and then trying to adopt it, it's not leading to tangible financial benefits. Okay, fact or fiction? When compared to firm-level AI adoption, workers are more likely to turn to AI. Put up your hand if you think this is fact. Okay, a few hands. Put up your hand if you think this is fiction. Okay, so if you said this was fact, you are correct. So despite workplaces not going all in on the AI hype, growing numbers of workers are turning to AI to support their work. And again, this is a survey conducted by the consulting firm KPMG, and what they found was that 51% of Canadian employees say they use generative AI at work. And for me, this kind of creates an interesting problem where formal firm-level strategies and policies related to AI may not match the use of the tool in the field, so workers are kind of doing it on their own without any sort of guidance, guardrails, advice from those who are familiar with the technology. Okay, here's a saucy one that gets a lot of hype in the media. Fact or fiction? AI will fully replace human workers. Put up your hand if you think this is fact. Okay, so no one in the audience. Put up your hand if you think this is fiction. Okay, so all of us. Well, if you said fiction, you'd be correct. AI is unlikely to be used to fully replace workers at this time. So I think this is a good news story. But all workers are exposed to AI. Okay? So when I refer to the term exposure, what I'm talking about is the makeup of your job tasks and the extent to which different job tasks can be performed by AI. And so a lot of economists have actually studied this idea of AI exposure, and they've built measures to assess this. And what they show is that at least all occupations have some tasks that can be performed by AI. So some studies conducted in the United States have found that about 60% of occupations consist of job tasks, of which 1/3 could be performed by AI. In another more recent study of large language models, they found that 19% of workers are in jobs where at least 50% of their job tasks could be performed by large language models. So this isn't saying that they are being performed, it's just like a hypothetical. But they highlight several key themes that I think it's important for all of us to highlight or to be aware of. The first being that our fear of AI taking our jobs is not a reality at this time. But we're going to increasingly work alongside AI, and so we ought to kind of be more familiar with the tool, know how to use it, know how to prompt it, know how to navigate it. And I think many of us are fearful, and we don't do that, and I think that's kind of a gap. So when we think about the types of jobs or job tasks that are most exposed to AI, it's often those that are kind of clearly laid out in a set of steps or rules that a computer can easily follow. Oftentimes they can be routine, but more increasingly they're often more complex and cognitive in nature. Perhaps there's a heavy reliance on interpreting language, synthesis. These are types of tasks that can be performed by AI tools. The types of jobs that are most affected by AI right now are those that we already use computers to perform, so it's kind of like enhancing it through additional, more advanced technologies. But what's interesting and something that our research has consistently showed is that jobs of higher quality, more prestigious jobs like doctors, accountants, lawyers, these are the types of jobs that are being most exposed to AI technology. And these jobs have previously been sheltered from technological change. So all of a sudden we're seeing kind of this new class of workers being affected by AI, both positively and negatively. Okay, now let's turn to kind of the focus of this group, health and safety. Fact or fiction? AI will make our workplaces safer and healthier. Put up your hands if you think this is fact. Okay. Put up your hand if you think this is fiction. Okay, so a bit of a mix. So if you said fiction, I would probably agree with you. I think right now, this is a fiction. Our research has indicated that there's a lack of evidence on the measurable impact AI can have on occupational injury or illness outcomes. But there are some signals to suggest that this could shift over time. There's some signals to suggest that there's both positive and negative implications that we need to be aware of. So let's walk through some of what the literature says or what some of the research is emerging to indicate. The benefits of AI can be several. Improved accuracy of work, can be quite significant for our health and safety. The ability to deploy AI tools to perform the most hazardous types of job tasks that can obviously remove the worker from the most riskiest situations. We can now allocate time to high-value activities and deploy the AI tools to take on the stuff that we don't like, the most stressful tasks, and that just improve our working lives. We can utilize it to monitor safety at work, and that could obviously have benefits. And then we can use it as a tool to promote health. We're seeing an increased number of technological tools that are using AI to promote mental health, physical health, and safety. But that comes at a cost. There's a lot of potential consequences to health and safety that we should be aware of. Working alongside AI could contribute to work intensification, performance pressures, or burnout for human workers who are all of a sudden thrust into this situation where they have to work alongside a machine that could be faster, potentially more efficient than they are, and that can just create a whole new set of conditions at work. Workers might have concerns about being constantly monitored by digital devices. Fears of surveillance, loss of privacy might also emerge from ongoing data collection that might impact job control and satisfaction. And some studies are speaking to our over-reliance on AI, which might diminish kind of the human nature of work, our decision-making, our creativity. We might just be turning to ChatGPT to kind of address all the issues that we might be facing. And there are a number of other documented risks associated with AI that are increasingly showing up more societally, but less so in the occupational health and safety world. And these can include issues like biases, where technology can contribute to unequal benefits for different groups. AI models might hallucinate, where they generate incorrect or misleading information or malfunction and contribute to unanticipated outcomes. AI can be used in ways that are not intended by the designer of the tool. The changing conditions at work that stem from AI have the potential to create both hazards that we've not fully understood. So again, these are issues that are kind of on the public agenda, but they're less on the agenda when it comes to health and safety. And we think that this is an issue that we ought to be kind of pursuing both as practitioners and as researchers. All right, let's turn back to our fact or fiction. The frequency of firms reporting the use of AI for OHS purposes is similar to the frequency of firms reporting the use of AI for business purposes. Fact or fiction? Put up your hand if you think it's fact. Put up your hand if you think it's fiction. Okay, so we have a very engaged audience, a very knowledgeable one. So if you said fiction, you'd be right. AI used for occupational health and safety is not keeping up with the AI used for business purposes. And I'll share with you some recent findings from a survey that we did of health and safety leaders in Ontario and British Columbia. And what we found was that just over 1/4 of these health and safety leaders reported that their firms were using AI for occupational health and safety purposes. 54% indicated that their firms were not using AI for occupational health and safety. And about 17% didn't actually know if they were using AI at all with it for health and safety purposes. And obviously this kind of creates an interesting issue where they don't even know if they're interacting with the tool. Interestingly, and as described on using the graph on the left side, a slightly greater proportion of participants indicated that their firms were using AI for any purposes, like I guess for more business purposes. And so this suggests that while the technology might not widely be applied to OHS purposes, it's kind of not matching what's happening in the field for business purposes. You might be interested to know what, amongst those who said they were using AI for occupational health and safety purposes, what were they using it for? I don't like to introduce specific vendors or technologies that are being used, but here are some of the kind of high-level themes. How are people using it for occupational health and safety? So some of the most frequently reported reasons included to monitor safety behaviors, and so some participants discussed using AI-enabled smart cameras or sensors. Other participants used AI to promote health-enhancing behaviors, such as AI worker mental health monitoring and assessment tools. AI was also used by participants to prevent psychological injuries like large language model therapy applications, whereas other participants frequently reported using AI to eliminate hazards. So for instance, some participants talked about AI automated fire suppression systems. We then asked all of the participants to rate their perceptions regarding the impact of AI and what it could have on occupational health and safety outcomes. And as indicated by the blue bars, participants from AI using firms held significantly more positive perceptions regarding the impact AI could have on occupational health and safety, and its role in creating a safer workplace and minimizing costs related to health and safety, and its impact on minimizing physical and psychological injuries at work. And this was then compared to participants from firms not adopting AI, or when compared to participants who didn't know whether or not they were adopting AI at work. Using another set of items we developed, we asked about concerns related to AI use as it relates to health and safety. And when taken together, participants from AI using firms reported significantly greater perceived concerns about AI design and adoption than participants from non-AI using firms. And notably, participants from AI using firms reported that high costs, a lack of understanding of the challenges of benefits, a lack of technical expertise, they were all associated with kind of particular challenges that they thought. So I think what I want to do is just kind of summarize what this says here, is that AI users were very optimistic about the potential impact it could have on health and safety, but they are also most aware of the challenges. And this is an important lesson for all of us to kind of be aware of, that when we expose ourselves to the tool, we're not only kind of exposing ourselves to the good things, but we're also then better understanding the potential bad things. And that kind of popped up in our data. We also asked participants about the hazardousness of their workplace and how that related to their AI use. And we asked them about a frequency of different exposures, such as heavy lifting, working from heights, or being exposed to hazardous chemicals. And what we found was that a greater proportion of AI users were in the high hazard group, meaning they were exposed to a greater number of hazards at a high frequency. And this was in comparison to participants from non-AI using firms who are more likely to report being exposed to a moderate or low number of hazards at a high frequency. And these findings suggest that perhaps the most safety-sensitive organizations, the most hazardous ones, are more likely to turn to AI to innovate their health and safety practices. Perhaps they've just faced challenges with their kind of their regular methodologies, and now they're kind of turning to these new tools to innovate. So I think this is the last fact or fiction, and that is, it's possible to design healthy and safe AI for workers. Put up your hand if you think this is fact. Okay. Put up your hand if you think this is fiction. Okay, so we have one person who doesn't think this is possible. Well, if you said it's fact, I think based on our experiences, there are growing recommendations on how to integrate an OHS lens to AI design and adoption decisions. And this is a very complex slide, so I'll just kind of provide a high-level summary. So our team recently broke down the AI life cycle in terms of how an AI system is defined and its goals, to its algorithmic training, its implementation in the field, and then to its validation and deployment. And we sought to understand how health and safety could play a role at each step of the AI system lifecycle. And I won't go through each of the steps, but I do want to highlight several key strategies because I think that's important for practitioners in this room. The first was of creating an oversight body within the workplace that includes both employers and workers who can provide a level of understanding regarding the role of the AI within their workplaces. And this would operate similar to a joint health and safety committee where everyone's kind of providing input on the health and safety tool or the AI tool. The second is to build literacy so that workers and employers can engage in critical discussions on AI without actually knowing what it is, how it works, how it operates in the field. We can't actually make intelligible decisions on how to navigate the challenges and opportunities that can exist. And very lastly, a kind of key theme that popped up a lot in our research was the importance of transparency in AI design and deployment decisions. Without this transparency, these tools operate in a black box. People are suspicious of them. They don't understand why their data is being collected and monitored, and that can create a number of health and safety challenges that I think we should be paying attention to. And so with that, I'm going to leave you there. Obviously, this is just a teaser, a small amount of research, a small amount of insights regarding this, this very important topic. I encourage you to please reach out if you have more questions about this, and obviously please do connect with the Institute for Work and Health. We have a lot of resources related to this topic. I do want to acknowledge our funders, in particular the WorkSafe Ontario Fund for providing support for this research, as well as some of our federal partners who are supporting this work. And so with that, I will turn it back to Ron. Thank you, everyone.
Have a seat. Thank you, Dr. Jetha. I'd like to take this opportunity to introduce, we're going to have a moderator.
Thank you very much. We've got about 25 minutes to go through a quick discussion with our panel. I'm going to start with a question. So Arif, in his presentation, sort of noted a lack of return on investment, a lack of investment from companies in AI at the moment. We now have some industry leaders here. Can you tell us, from your experience, where do you think might be the biggest opportunities for investment in artificial intelligence in improving occupational health and safety outcomes? Who would like to take that large question first?
You're pointing at me.
I'm just generally looking across.
All right. So actually, we'll have a little information here. I think that the biggest issue with AI right now, just like any other technology, is that the technology is being built, but it's looking for solutions. Right? That's the biggest problem. And us being in the out in the field, that's one of the areas we are feeling, and we have some good ideas. We're going to showcase some of those. So, but that's the thing. AI is looking for a good story.
Brenton, I can see you looking across at me.
So I would add that not just in health and safety, but in any industry, you want to identify the narrow, very specific high use case where you have business value, measurable outcomes, and human oversights built into the application before you invest in and build the solutions.
Again, on top of those, after you identify opportunity, give you some experiment, identify feasibility, next level is scaling. That means when you prove those works and how you make sure those technology works embedded every part of the business of the company, everything you work, including the safety and health related, so that the investment can actually pay off, have the outcome. Just like today's conference, the theme is from policy to outcome. That's the bottom line. That's where the 2% of the companies have actual value was the one, not just do experiment, actually scale, really do the hard work, make it happen to every corner, every part of workers. They are touching the health and safety part. Thank you.
Okay, Arif, do you want to?
No, I just want to add to that, which is that 2% figure, it skews when we think about the entire Canadian population, but actually when you look at it's the big companies, the new companies, they're investing the most into AI technology, which makes a lot of sense. They have the resources and the capacity to do that. But oftentimes, health and safety plays out in small, resource-constrained environments. And I think these types of tools offer a potential opportunity for those who are struggling with resources and capacity to now tackle these issues at a scale that maybe they hadn't in the past. So I think we ought to be looking at ways that we can deploy the tool to maximize our abilities within environments where we don't have the financial weight to support the work that we do.
Okay, so I'm hearing, from the panel that there's opportunities here for greater investment in AI, that we need to really think about all the different types of work tasks that could be included. And there was some mention of workers being involved in the process. Arif, you mentioned in your presentation, AI is not replacing us just yet. You also identified some issues around worker trust, privacy concerns. I guess from the panel's perspective, how do you think it's best to navigate those risks in terms of or which parts of AI adoption pose the biggest risks to worker trust? Why don't we, Brenton, do you want to start?
Sure. So for AI trust, what I find in where I work from is primarily where you have data quality issues and poor data management. Lots of organizations struggles with data management. It's just not a thing that everybody invests in. When you have poor data and over-reliance workers who trust the AI's response, then that leads to trust breakage. Because let's say the data that you have is maybe outdated, or it's not something that's true anymore, or you have incomplete data and now we feed it to the AI systems that answers, and you as a worker make a decision based on that data, that will result in potential challenges downstream, and that will break the trust from workers or companies to continue adopting AI?
I can add more on that and give an example on trust. How to build the trust inside of an AI application, and just mention the data quality, that's one side. Another side is people. The trust, it's the people put the trust into that AI tool implementation. I have been leading the AI development in Manulife, which is the largest insurance company in Canada, on AI development and implementation, and give you one example how the trust can be built from human and also without human. One, the example is call center. We built the first call center knowledge management bot 2 years ago. That's the Gen AI. When Gen AI first started, using large language model. The problem trying to solve was when a customer call center, in this case, a long-term care insurance, which the parents bought the insurance 30, 40 years ago, now is 70, 80 years old, need somebody to care them. And quite often, it's the children call, say, my parents cannot move and we need somebody to take care of them. It is covered by that policy. The call center need to log into a system, find that legal document and 70, 80 pages PDF file, and find that paragraph, say, yes, read it, it's covered, or not. Then how much money it is, then log another system, here's how much money has been covered. Usually take about 5 to 20 minutes for complex questions. Simple questions they can answer right away. With this AI solution, we put all the legal contracts, all the knowledge base, all the training materials, and all the financial related customer information, all put together, indexed with a large language model to search it. Once the question come in, the typing the question, now only about a few seconds, the answer come up with bullet points, because the call center people doesn't like read paragraphs, because we're on the call, and simple bullet point answer quickly. This really helped them. But how to build the trust in this? When I first proposed this, the leaders was very worried. Everybody knows at that time, 2 years ago, hallucination was a major thing, all the news. And what we did, 2 things. First, have the call center people work with us. And as a part of the team, every answer in the early development, they review, they provide feedback. That's called human in the loop. Second, we have millions of calls. You can't, in the few seconds, you can't have another person to double check. What we built was inside of that AI solution, have an independent, separate large language model, which is better than the original answer generated, checking on that answer before sending it out to the user, and to make sure that answer was actually fact-based from that legal contract, and also addressing that question. Just like example, in the school, a student have an answer, homework, before walk out the door, a teacher sit there, examine that answer. That build extra. We also show that confidence score to the call center staff. Say there's a line, 1 out of 5, that's good enough. That's good. 1 out of 5, that's hallucination. 5 out of 5 is good. Usually we say about 3, that's good enough. Just by that really helped them to build the trust. One of the chief operation officer of that line business, after my presentation, he walked to me and said, Eugene, I'm glad you built that in. Because without that, I really don't want you to implement in my call center for this, just to support the trust. Thank you.
Sabish?
Thank you. I'll try to be short, but that was very, very, very good. So when we started the health and safety business, what I realized the biggest problem was ignorance at the field worker. And when we created our whole software system, it was about getting that information to the person. You can't have an expert at the field at every time. So for us, AI really scales our business. And we will show you some of the interesting things we do later on today. And so for us, our commitment and amount of funds we are spending on it is actually quite phenomenal. And we are doing a lot of this work because it scales our business. We want to be able to get the expertise right to the people so that they don't have to rely on calling a Minister of Labor person, because they have to do a lot more other things. So it really, really improves things. And like Dr. Jetha said, it's all good for now till the robots show up. Correct?
I didn't say that. I just we're not at a threat, guys. Don't run out of the room. One thing I want to just add to complement this is the importance of AI literacy. It's like a basic skill that we ought to all be building, and it's important for workers in particular because, as you can imagine, there's a lot of folks here who are leading AI deployment from the top down, but the workers also need to have the capacity to understand what they're working alongside, how to navigate it, and how to participate in conversations like Eugene was talking about, where they can provide feedback to the training of these models, to the calibration of these models, because it feels technical, but without the literacy, you can't jump in and participate. And that's what I think is an important kind of complement to what folks here said.
Okay, so I think this leads pretty well to my next question, which is around how, I guess, the adoption of AI. So there are some people who sort of say, well, AI, how is that different to other transformative things that have happened, like, electricity, the printing press, the Industrial Revolution? And one of the things that Arif was talking about is how what's probably different with artificial intelligence is it's actually replacing cognitive tasks. So it's replacing expert judgment or complementing expert judgment, which I think is one of the things Sebesh and Eugene, you both sort of discussed around how it has the capacity to be complementary and help provide expert human intelligence in situations where maybe that's not available or would be very costly. So from your perspectives, as people who have sort of are exploring this space, how should we be integrating it with humans in I guess, humans in the loop, if you like? So how should it be used? Should it be used to replace people, replace tasks, or should it be used to sort of complement and support people in terms of those activities? I'm going to start with you, Sebesh, and then we'll go back along.
Thank you, Dr. Smith. I've been in the industry for 40-odd years, and I can tell you, every time a new computer technology came, it increased the number of jobs. And I think it'll absolutely complement people once we figure out how it works right. Once AI has a story, as I said before, it will start complementing. People should not be seeing that as a threat, just like they shouldn't have seen the internet as a threat. I mean, everybody said real estate agents, and they still say that. Real estate agents, and who's the other one? Travel agents will be out of business. There's quite a few of them, right? People say media will be gone. No, media has changed, right? So I feel AI will definitely complement things and definitely increase productivity if it's implemented right.
Sure. So I'll add to that for sure. So one thing is, in healthcare, where we build AI services, one of the stuff that we be careful with is not to replace expert judgments or qualified professionals' judgment. So the way we use AI is to leverage it to get the data, identify patterns, bring the citations, and show it to the physicians and nurses and ask them to make the judgment. Because even when we do this, we make sure that the data that comes from it is qualified, it's actually complete, and we identify these things in the responses, because there are not in every single position the AI is implemented, there will be missing data somewhere that could lead to potential issues. So when we implement it, we always make sure citations there, and we show the recommended answer based on the data we have, and ask the experts to interpret it and give the judgment. So I see AI to be replacing the manual effort of getting these data and prioritizing alerts. I think that AI will do a great job of, but ultimately qualified professionals and humans will need to make the judgment.
So I agree with that, but pushing a little bit further on that is the AI's capability is growing. The example I gave on the call center, that's more called information retrieval. Find something for me, help me. But now with the capability of reasoning of large language model, in addition help you to get something you want, now can help you what you want to think. Even back to the presentation, the AI definition is simulate some of humans' capability, now really getting home of many capability human we are very proud is thinking, make judgment. I can give example of another solution we built recently. Is reasoning-based underwriting in any insurance context are heavy human judgment decision-making process, but it's not free. It is heavily structured, evidence-based, and require a long time training. Underwriting manual in different contexts. Usually those manual of hundreds of pages and with tables, charts, and height and weight, age, medical exam, all those things. For an experienced underwriter, usually require 5 years to becoming a sufficient and handle those. We recently built one to handle simpler, back to your comments, for a simpler underwriting cases. It's called quick quote. That means in the insurance line in the US. This is already public released. In this application, a summary of a client coming and usually take a team of underwriters and they read, follow the manual, and based on training, make decisions how this is person at high risk, low risk, all the smoking, medical exam, all these. Now with this solution, we instruct this large language model, a multiple one, to read the materials, identify the diagnosis called impairment, and then look through the manual, just like a human was trained, make judgment on those evidence based on the manual instruction. Then come up, summarize multiple evidence and multiple line of judgment. Somebody diabetes, hypertension, and overweight, but in a good medical compliance of medication, all these, and could summarize into a risk score, risk rating, and automatically write a summary report, reply back. Usually take a day of get response in that line, non-binding, now only within 15 minutes. But that's for half of the cases, but 4,000 a month, 2,000 can handle. In these cases, can free the human underwriters of time, more dedicated for complex cases. We automatically triage to humans for complex ones. That improve the quality, not replace their job, but make their job much more valuable. At the same time, improve the efficiency of process and consistency of the process. Thank you.
Okay. Arif.
I think this just highlights the importance of decision makers in determining how these AI tools are being utilized. And obviously there's a big productivity gain that we can obtain from utilizing these tools, but I think we ought to also be thinking about what can make the lives of workers safer, healthier, how can we improve the quality of working conditions utilizing these tools? So a good example is deploying tools to remove the most hazardous situations or remove workers from these most hazardous situations, utilizing the tools so that they can perform the most strenuous, repetitive types of tasks, the ones that are most dangerous. These are the types of decisions that we can make that can ensure that the AI tools that we're utilizing not only kind of improve the bottom line, but also can improve safety.
Okay, I think that's good. That sort of leads into the last question I have for the panel, and I think we can go sort of left to right. So I guess we've heard today about, not a lot of people are using, or maybe not a lot of companies are seeking out the opportunities to use AI for health and safety activities or in activities in general. There's these issues of trust that companies have to deal with in terms of how they roll out AI, how they think about the tasks that it should be replacing. From your perspective, for the people in the room here who are now thinking about, well, I ought to start to understand this technology, I ought to think about how I can integrate it into health and safety, what would be your suggestions for the things that they should be thinking about when it comes to AI adoption over the next few years as it relates to health and safety?
Yeah, I think for me, it's personally just building awareness on the basic fundamental building blocks of AI. Like, we should know what an algorithm is. We should know what data means. We should know about how it's deployed. And this will be particularly beneficial because oftentimes these tools are created by third-party vendors, and it feels as though there's a black box surrounding them. By us building familiarity, knowledge, we can better work with those folks to ensure that the deployment of these tools don't harm our workers and only improve their working lives. And so for me, I think it's all about AI literacy, capacity building, and then as a researcher, building more evidence base in this area. I think we just have to have better evidence so that we can inform folks in the field, practitioners who are building these types of tools, and help them kind of better calibrate the tools so that they are as safe as they possibly can be.
Thank you. So I want to bring this interesting, very good question, by the way, to what I experienced. I had somebody come to me and said, God, I got to learn all this AI. And it was an older person. And they said, I got to learn all this AI, and I don't know what it's used for. And I don't really care about any of these things. So I said, it's very easy. What do you like to do? What do you want to do that you're struggling with? And the person said, well, I want to do A, B, C, D. I said, now ask somebody, how can AI help you do that? That's how I got the engagement. That made a huge difference. And I feel that is how people are going to start getting engaged. It's going to be getting engaged by solving their problems, not a global problem.
For me, because I after left the WSAB, went to Manulife to help set up the AI function, and it's been 10 years. I saw the journey, and I have two things I want to share. First, top-down is leadership. For this type of transformative application, just bottom grassroots works, but only work at scale. The top-down leaders need to see the value and committed. Second is really need to not make AI a big deal. And AI only works when it fits every single worker's need, every single task need. Recently, I organized an annual competition for AI across company. It has been several years, but the last year's topic is automate my boring staff. I got several hundred people sign up, make teams, and I gave them the prize. It's the latest model of earbud. Really incentive people, and a lot of innovative ideas, and those are not expensive ones, simple ones.
I agree with all the comments. So start with AI literacy for sure. Make sure that your workforce is trained and they're aware of AI, and start experimenting with it, because it will be very specific to your industry or for your your company itself, you would find different tools might play differently. So you would definitely want to start experimenting sooner and figure out where you can apply AI. I would say start there and invest definitely into data management and increasing the quality, because as AI becomes more capable, and we can see that every 3 months there is much more capable AI models keep coming up. If you don't have the data, if you don't have the infrastructure, you don't have the strategy, then you would just be wasting token money and not really get the value out of it. So define that right now, start with strategy and start experimenting.
Okay, so what I'm hearing here from the panel is we need to build awareness, build literacy among our workforce. We need to have senior management commitment, and we need to think creatively about what are the things that we would want AI to do, what are the things that we'd like to keep for ourselves, and explore the different aspects of our job or jobs in the workplace that could be complemented or replaced, the boring tasks, as Eugene said, by artificial intelligence. So I'd like to thank the panel very much for their time and their expertise, and I guess I hand it back over to you now.
Excellent. Thank you very much. It's a great topic, great introduction. We're just at the early stages. I did have the opportunity to have a conversation with Jeffrey Hinton, and as you know, in 2024, him and his colleague had won the Nobel Peace Prize. And one thing that he had said that really stuck with me is it took us 70 years to get where we are today, and we will make that same level of transition in about 6 months and every 6 months after. So this is a really fast-moving event. It's a game changer. The number one question that everybody tried to get Dr. Hinton to say was, will AI become self-aware? And at this point, no. So Starlink, Arnold Schwarzenegger, I'll be back, is not going to happen immediately. So we're good. So let's hear it for the panel.